So again, my name is Fiala. I'm a senior research analyst with Program Design. Okay, I think I unmuted my line. Can everyone hear me?
Yes, but could you speak a little louder?
Yeah. Sorry. It's the phone, I promise. I'm holding it right up to my mouth, so we'll hopefully this works. So again, senior research analyst, program design and evaluation services in the Oregon Public Health Division. And the research that we're going to be reviewing today as part of a pretty comprehensive NIH grant-funded research project led by my colleague Julia Dilley, who is also on the webinar today, looking at the effects of marijuana legalization in both Oregon and Washington State. So this is a small piece of it. And before we jump into the research, I wanted to start out with this quote from the 2012 Surgeon General's report on preventing tobacco use among youth and young adults. And it reads, advertising and promotional activities by tobacco companies have been shown to cause the onset and continuation of smoking among adolescents and young adults. And so essentially this shows that we know advertising works. In this case, it's for tobacco. But I think it's an easy connection between marijuana advertising and youth use as well. And so it kind of frames the reason why we wanted to systematically collect advertising exposure among both adults, young adults, and youth. Okay. And before we dive into the research, I wanted to familiarize everyone with some marijuana legalization milestones in Oregon. So first was the passage of Ballot Measures in November of 2014, and that was the Ballot Initiative that legalized marijuana, cannabis, for recreational use in the state. And then in October of 2015, limited retail sales of marijuana were allowed through existing medical marijuana dispensaries. We had a fairly robust registered dispensary market in the state at the time. I think there were a little over 300. So in October of 2015, those existing dispensaries were allowed to sell retail products, and I believe it was about 80% of them chose to do so. And then from October 2015 to October 2016 is when licensing began through the Oregon Liquor. They could apply for and receive a license to sell legal recreational marijuana. And then in December of the year, retail marijuana sales in those medical dispensaries had to end, and dispensaries had to decide if they wanted to focus on medical marijuana or become one of those recreational retailers. So we technically had the start of this market in October 2015, and the full market expansion in October 2016. There's a quick timeline for our milestones. And then here's a nice overview of the current marijuana retailers in Oregon. And the slide says as of November 14th, but I went onto the Oregon Liquor Control Commission website this morning, and as of March 9th, 2018, Oregon had 532 retail licenses awarded or given by the Oregon Liquor Control Commission. So it kind of gives you a sense of the number of retailers in the state at the moment, 532 licenses, and then you can see from this map from the OLCC website where those retailers are clustered. Okay, and now for the fun part. I hope everyone thinks going over data sources is fun. I'll try to keep it brief. So before we review the results, wanted to talk a little bit about how the data were collected and go over a couple of our core state surveillance surveys. So first is the Oregon Behavioral Risk Factor Surveillance System, or the BRFIS, as we affectionately call it. And this is our primary adult risk behavior survey that's conducted every year in the state among adults aged 18 and older. And you get about 10,000 respondents every year to that, and it's a telephone survey. The data are weighted to represent adults in the state. And there were marijuana questions added to that survey in 2014. However, these questions focused more on ever use, current use, in general, the product types, but it did not include questions around advertising because space is pretty limited and competitive on the survey. So in 2015, advertising exposure questions were added to an online survey that the Public Health Division also runs as a complement to the behavioral risk factor surveillance system because it's much, much less expensive and the turnaround time is about 2 months instead of 18 months. So this online survey is conducted twice a year, once in the spring, once in the fall, again conducted among Oregon adults 18 and older. We get about 2,000 respondents each wave of the survey, so 4,000 respondents in a year. It's an online panel that has agreed to be on a panel and to take surveys, and they are incentivized with e-rewards to take these surveys. These data were also weighted to try to represent the demographics of the state. And again, our advertising questions were added in the fall of 2015. And those are the data that we're going to review today. And in addition to the adult advertising exposure that was highlighted in the American Journal of Public Health research article, we're also going to take a look at some fairly recent data from our youth risk behavior survey. It's called Oregon Healthy Teens, and it's conducted every odd year. It's conducted in schools among Oregon 8th and 11th graders. We get about 16,000 8th grade respondents and 14,000 11th grade respondents every round. They take it on hard copy or on a computer. I already said it's completed in the schools. It's also weighted to represent the demographics of students in the state. And advertising questions were added in 2017 to that survey. Again, kind of a competitive survey to get questions on there, but we were able to get some on in 2017, which is what we'll be reviewing today as well. So thanks for bearing with me with our data sources. Now we're going to quickly review the actual questions we asked. So this is the question from that online survey of adults. So we asked in the last 30 days, so past month, how often have you seen or heard advertising for marijuana products or stores in your community? And then we included a couple examples there. It could be on TV, although that's pretty unlikely since it's still illegal at the federal level. Radio, signs, billboards, newspapers, pamphlets, street side marketing. There weren't any other questions that were in the field to draw from, so this is kind of our first attempt at a question. And our response options were I haven't seen or heard product advertising a few times in the last 30 days, several times, nearly all of the last 30 days, trying to get a bit at the frequency of exposure. So that's that question. And then of respondents to the survey that indicated any exposure, we asked a follow-up question about the types of advertising they were exposed to in the last month. So those folks were asked in the last 30 days, have you seen or heard advertising for marijuana products or stores in your community on the radio, billboards, magazines, street side marketing, storefronts, pamphlets, sign waivers, online, and at outdoor events? And these response options were just based on what we were seeing in the environment, and really in this first iteration of the questions trying to capture every venue that they could possibly see advertising. I don't see TVs on this list, but it was an option. So also TV. Okay, and then for the Oregon Healthy Teen Survey, for those 8th and 11th graders, we asked, during the past 30 days, have you seen an advertisement for marijuana products or stores? And then we included these 5 categories. We had to be a bit more concise in our language on that survey because it's pretty competitive and expensive. So we focused on exposure to magazines and newspapers, storefronts, online, which we thought would be an important one for youth in particular, on billboards and on sidewalks. And we combined those kind of street side sandwich board signs as well as people wearing or waving signs on the sidewalk. So those are the survey questions that we asked. And this is what it looks like on the Oregon Healthy Teen Survey. No one probably cares, but I wanted to include it. And then if we consider in our legalization timeline when these questions were asked, just wanted to quickly go over that. So again, for Burfus, we did start asking questions in 2014 after the passage of Measure 91, but we weren't able to get those advertising questions on there. So we're relying on these panel survey data that were fielded in November of 2015 and then again in spring 2016, which were combined for that article. So that's when those data were collected. And then we'll also be looking at the Oregon Healthy Teens survey data that were collected in 2017, so after this full market opening. So just something to keep in mind as we look at the adult data, it was collected after the start of those limited sales in dispensaries, and then our youth data were collected after the full market completely opened. So keep that in mind. Okay, and now we're going to get into the results, and these again were published in the published online in November in the American Journal of Public Health. And so here are the results for that first question for those adults. So adult exposure to marijuana stores and advertising in their communities. And these were the combined data from fall 2015 and spring 2016. And we combined those data because in the paper we wanted to look at demographic differences and needed to have a larger sample size. So for that first question we looked at, we see that little over half of the adults, 55%, reported any exposure to marijuana advertising. So either a few times, several times, or nearly every day. So that was half. And then when we split it out in a bit more granularity, looking at frequency, we see that about a third reported a few times in the past 30 days, about 20% reported several times, and then 7% reported seeing advertising in their communities nearly every day. Okay. And then we didn't go over this question, but on the survey we also asked adults if they had seen or heard any health risk messages in their communities related to marijuana, because we wanted a comparison of advertising, which is this promotion of marijuana by the industry, by a legal industry, and comparing that to exposure to health risk messages among adults. And so you can see that exposure to those health risk messages in that same time period were significantly less than exposure to the advertising. So again, we had about half of adults reporting advertising exposure, and then about a little more than a quarter of adults reporting exposure to health risk messages. And so in a couple slides, we'll take a look at what those health risk messages could have looked like. And then we see across these more granular exposure categories that, again, health risk message exposure was lower than advertising exposure. And you can see a pretty large difference, especially in these higher frequency categories between advertising and health risk messages. Okay. And here are the results for that follow-up question that those adults received. So they reported any exposure, and then they were asked what types of advertising they were exposed to in the past 30 days. And so we can see that advertising on the storefronts, on the actual retail stores, was reported the most. And these categories aren't mutually exclusive. So adults could report as many types of exposure in the past 30 days as they wanted to. And so we had 75% of adults who were exposed to advertising report exposure from storefronts. 67% report that street side marketing, so those sandwich boards, and then a little over half reported exposure from billboards in the environment. Some of the less frequent reported types of exposure were from magazines and newspapers, those sign waivers, pamphlets and flyers, etc. But if we focus on those that are over half of those adults, it's billboards, street side marketing, and storefronts. And we're going to have some examples of what those look like to make that a bit more tangible. Okay, and then as I said, we also looked at any demographic differences in that any exposure. And we found that there weren't really statistically significant differences by gender, our age groups that we looked at, race, ethnicity, education level, if they were in the metro area, so more urban area versus more rural area. And also exposure didn't differ significantly by marijuana use status. So even if you reported never having used marijuana, you were exposed to a similar level of marijuana advertising as if you were a current marijuana user. And again, across the age groups, pretty equal exposure to marijuana advertising. The differences that we did find were in a self-report measure of a marijuana store in their neighborhood. And so we just asked, is there a marijuana dispensary or store in your neighborhood? It was just a yes/no question. And so for those that said yes, 63% had any exposure, and those who said no, it was still 53%, but that was a statistically significant difference. And then we also tried to do a more objective measure of the presence of marijuana stores in people's communities. And so the Oregon Liquor Control Commission has the addresses of all those registered dispensaries that were operating during that time of retail sales when we asked these questions. And so we mapped those and found that 57% of those with a store, with a dispensary in their community reported any exposure compared to 33% of those who didn't have a store in their area. So again, kind of similar levels of exposure across those demographic groups. So just equal exposure, pretty ubiquitous in the environment, but then did find differences in exposure based on the presence of a store, which makes sense, but it did pan out in the data. Okay, and then for the American Journal of Public Health article, we did focus on those two waves of the survey and those combined data because we were really focusing on looking at demographic differences. But we have asked the marijuana questions in the same format over multiple waves of the panel survey. And so for you all, I wanted to show you some of the over time data. And you can see that from fall 2015 to spring 2017, that there was a steady increase in any exposure to advertising over this time period. Again, moving from those early limited sales in marijuana dispensaries in the fall of 2015 to the full market being open in spring of 2017. And then when we look at it in that more granular detail, you can see that the several times exposure has stayed pretty consistent, but we have seen an uptick in the a few times and nearly every day, one of those extreme categories. So generally increasing exposure over time. Okay, and then I just had to note that after the study came out, we had some coverage in the Marijuana Moment blog, and the takeaway in this story, which is noticeably absent in our actual article, is that marijuana ads don't increase marijuana use. And I guess this was their main takeaway. So just wanted to take the opportunity to say that we wouldn't draw any kind of causal conclusions or any kind of temporal conclusions based on the study. It's just this point in time assessment of these data. The main takeaway is that demographics didn't really matter. Everyone in the community is equally exposed to this advertising, and we really didn't make and shouldn't be making any claims about advertising increasing use based on our study data. Okay, so we reviewed the adult data from that online survey. Again, those are the data covered in the AJPH article, but I also wanted to share some of our youth advertising exposure data. And this is from 2017, fairly recent to come out. And we see that any exposure was 67% for 8th graders and 72% for 11th graders. So higher than that 55% for adults that we looked at. And then when breaking it out by advertising type, we see that for both 8th and 11th graders, those storefronts are up there. But one thing to note, I think, is that online was the top category reported for 11th graders and the second to top category for 8th graders, and it was 22% for adults. So not surprising that youth being online are exposed to it more in that format. But again, for those storefronts, focusing on 11th graders, we had 44% report exposure in storefronts, about a third report exposure to billboards, about a third report exposure to street side marketing. So, but I think the main takeaway is that the majority reported exposure to marijuana advertising in the past month for both 8th and 11th graders. Okay, and now, how are we doing on time?
You're fine. You can keep going about all these interesting signs.
Okay, perfect. I know, now we're getting to the fun part, right? Okay, so your reward for bearing with me through the surveillance system descriptions and the survey questions is to now get to see some examples of what we're talking about. So first we're going to look at what is in the environment in terms of health risk messages. And so these are examples of the required signs that are at the point of sale in retail outlets. So these wouldn't necessarily be seen by the general public, but they are seen by those going to the stores to purchase. And so the main themes of these are to keep it out of reach, and so focusing on safe storage so that we don't have poisonings from children getting into it and consuming it. And then also being safe about marijuana use while pregnant or breastfeeding with the tagline, "Don't pass it on." So again, these are those point of sale messages. The Oregon Liquor Control Commission also has this campaign called Educate Before You Recreate, just informing people about the law in general, about how it can't pass state lines. You have to be 21 or older to possess. In terms of home grow, the number of plants you can have, etc. And then on the right here, kind of similar messages as those point of sale posters, but these are cards that retailers are required to hand out with every purchase of a marijuana product in the stores. And again, focusing on safe storage practices, and then really considering your pregnancy or breastfeeding. Okay, and then also at the time in 2016, the Oregon Public Health Division had a pilot youth marijuana prevention campaign. They did extensive audience testing and developed this prevention campaign that was released in the Portland metro area, so pretty urban, most populated area in the state, as well as two more rural sites across the state. It was called Stay True to You, and it went for about a year, and I think I'm actually not quite sure where it ended up in the legislature, but I know that they delivered an evaluation report to the legislature to determine ongoing sustainable funding for youth marijuana prevention campaigns in the state. So just wanted to put this here as well. So kind of in contrast to those point of sale warnings, these youth-focused messages were out in the environment for the general public. And there was also a complimentary parent campaign on how to talk to your child about marijuana use. Okay, so those are the health risk messages. Now we're going to go through several examples of cannabis advertising in the state, just to make those categories of the questions a bit more tangible. So here we see, starting from the left, one of those sandwich boards that would count as street side marketing. In the middle, this is a little different of a category, but this is a kiosk for a local newspaper, and it was highlighting the cover story in the newspaper that week. And it was called the Buddy System and focused on pairing Girl Scout cookies with cannabis strains. That was kind of an interesting example. And then on the right, we have another example of a kind of street side marketing poster for cannabis. And this one is notable to me for its friendly cartoon owl, which I don't know would be allowed anymore, because there are some advertising restrictions around images that would appeal to youth. Okay, and then here are some examples of some storefronts. So on the left, kind of electric lettuce with the words dope and reefer in the window, very colorful. On the right, a bit more subdued Rose City Wellness marijuana dispensary, although it is interesting they're using the word wellness, connotations there. On the left here, we see one of those sign waivers advertising recreational cannabis for $10 a gram on the sidewalk. Also included, I see these stickers everywhere from WeedWorks and WeedMaps, different cannabis stores that are kind of just stuck up on things throughout the city. And then here's, I think this is potentially mine and my colleague Julia's, one of our favorite billboards, if you can put it that way. But this billboard was up right as you're coming from Washington State across the bridge into Oregon, and it was advertising a free bong with a 1/4 ounce purchase, advertising the name of the store, that it was next to Denny's. So just here's an example of some of the billboard advertising we're seeing, which again was one of those top 3 exposure types from that adult survey. Here's another billboard we thought was pretty interesting because it was advertising marijuana dabs or dabbing marijuana concentrates, which is a bit more of an alternative form of marijuana use maybe than a lot of people would think about generally smoking it or eating the edibles. But dabs and concentrates, as the name implies, tend to have a higher concentration of THC and may have a higher probability of using too much. And also interesting in that it co-ops the Got Milk slogan. Okay, and then on the top, another advertising in Portland for marijuana delivery. So there's a specific license specific to the city of Portland that allows the delivery of marijuana products. So promoting that on the billboard. And then we thought this was interesting as well, this dispensary noting that they would offer a 10% discount to all Sherwood residents. It's a dispensary in Newburgh, a different city, and Sherwood has a local retail ban, so they're not actually allowed in the city. So this dispensary in a neighboring city is offering discounts to those residents. So very, very interesting. Okay, and then another billboard, kind of a very youth-friendly image of a unicorn on it, talking about where you're going to grow your 4 plants, referring to the number of plants you can have in your home. I'll quickly go through these because I have a feeling you're getting the picture. But here's one from Washington State, Got Weed. That is interesting, and that a school bus is right there, so exposure to youth. And then another one from Tacoma, Washington, I'm so high right meow, with the cat. And then lastly, we are seeing these billboards pop up from WeedMaps. They're kind of a cannabis legalization, pro-legalization campaign. And we're seeing these in Oregon, I believe Washington State, and then also colleagues from Michigan, which doesn't have legal recreational marijuana, also reported seeing these same billboards. So these are throughout the country. And this one focused on how Medicaid could have saved $1 billion if marijuana was legal. States that legalized marijuana had 25% fewer opioid-related deaths, so relating legalization to the opioid epidemic. And then the last one we've seen is since legalizing, Colorado has not seen an increase in youth marijuana use. Yeah, pro-legalization campaign, kind of using data. Well, definitely using data, not in the best way, but just also something to be aware of in the environment. Okay, so I've talked for a long time. Thank you so much for having me, and I hope that was interesting, reviewing our study results and also reviewing just what's going on in the environment. So, any questions?
So I'll start off asking a couple questions, and
Okay.
then we can move to audience questions. Anybody in the audience can type a question into the chat box in Skype. Any questions you have for Stephen? Okay. The first question I have here is, how is marijuana advertising currently regulated in Oregon, and then how is that different from Washington's regulations and Colorado's regulations?
Yeah, that's a great question. So there are several regulations in Oregon related to the messages on marijuana advertising. They can't falsely claim therapeutic properties. They can't overtly appeal to children, both in the language and the images included, so there can't be cartoon characters. And that aspect applies both to advertising as well as some of the packaging and labeling rules for the state on the actual products themselves. Not allowed to have cartoon characters or packaging that overtly appeals to children. For street side marketing, like we saw the sign waivers, we saw those sandwich board signs, saw some of that storefront advertising. There really aren't any restrictions in Oregon related to that. The billboard restriction that applies in Oregon is based on a voluntary policy that the alcohol industry apparently self-imposes, and it states that marijuana advertising is only allowed when less than 30% of the audience is younger than 21 years. So that's the rule in Oregon, and I believe Colorado also has that rule. However, we like to think about how there's really no clear description in the law about who bears the burden of proof for ensuring that the advertising has less than 30% of an audience younger than 21. So we're not really sure how feasible that is to actually implement. And then there are also a couple rules around advertising on mobile phones. It has to be an opt-in policy with a really clear way of opting out. Trying to think of others. I think in Oregon in general, the rules have primarily focused on those therapeutic messages that don't appeal to kids, and that 30% rule. But there's really not a lot of regulations around like those storefronts and their properties themselves, which is interesting because if we think about our results, we had storefronts as number one, and then we had the street side marketing combined with those sign waivers, and then we also had billboards. And I think if we look to Washington State and Colorado, they offer some pretty common sense advertising regulations that could be implemented. And advertising regulations are difficult in that we run up against First Amendment issues. And I'm not a legal scholar, so I'm not trying to offer any kind of policy opinion. But I know from experience with tobacco prevention that it's pretty hard to regulate, especially at the state and local levels in fear of a lawsuit. But Washington State and Colorado have taken, I think, a couple of really common sense strategies. In Washington State, they limit licensed retailers to 2 storefront signs. It has to be on the property, affixed to something. And they also have size restrictions. And also they regulate the content. So it has to have just the name on it. And so in that way, you can't really use the storefront as a huge advertising mechanism. You can't have the sandwich board plus the sign waiver plus a banner plus balloons, which I've seen. You're limited to just those 2 signs that have size restrictions and content restrictions that are just saying that you're there as a store and not necessarily functioning as an ad itself. And then Colorado only allows billboards as fixed signs on a marijuana store's zone lot. And so for me, I see billboards everywhere. And I am in Portland, so it's a more populated area. There's a higher density of retail stores, so maybe that makes sense. But something like what Colorado has done with allowing billboards just on the marijuana store zone lots, I think would reduce the density of advertising quite a bit from my perspective. So again, kind of a difficult thing with the First Amendment issues, but I think Oregon could look to what Colorado and Washington have already done. I hope that answered your question somewhat.
Yeah, I think it does. I actually have a follow-up to that, which is, in Oregon, are there still differences between how marijuana advertising is regulated and how alcohol and tobacco advertising are regulated?
Yeah, that's a good question. Oh, sorry.
Oh, I was going to ask if there's any kind of stricter regulation on alcohol and tobacco that you think should include marijuana now?
Yeah, that's a great question. A lot of the tobacco advertising regulations have come out at the federal level from the Tobacco Master Settlement Agreement and Obama's Family Smoking, what's it called? Family Smoking Prevention and Tobacco Control Act, which limits advertising on television and radio and magazines and transit stations and billboards. And so federally, tobacco advertising is restricted pretty significantly, especially for cigarettes. So it takes care of a lot of that advertising. Tobacco advertising is primarily concentrated inside stores and in the store exteriors themselves. So they can't have the billboards and they can't advertise certain products in magazines. So again, kind of those federal regulations takes care of a lot of that. I know state and local governments are still working in those retail environments to restrict some of the advertising. But those federal regulations definitely help. I'm not as familiar with alcohol regulations, but I do know that 30% rule was taken from an alcohol regulation. But again, that is a voluntary regulation for the alcohol industry, and again has those enforcement and burden of proof implications. But I can't speak as much to the alcohol restrictions. I mean, I see alcohol billboards throughout the city, not quite as much as marijuana because it's a newer industry, but I have a general sense that they're less restricted than that they're not very restricted as well. And we saw that picture of the alcohol billboard right below the marijuana billboard, which is kind of interesting.
And then a follow-up to that from Robin is, how are the advertising regulations being enforced? Maybe you can speak to Oregon.
Yeah, that's a great question. I honestly do not know.
I can actually add to that.
Oh, perfect.
I live in Bend, Oregon, so the other side of the mountains from Portland, Oregon, and we are much more rural than Portland. And when we are working with the Oregon Liquor and Control Commission, OLCC, they say that their hands are pretty tied when it comes to enforcing the billboards, because all the company has to do is show them their demographic proof, quote unquote, and that's usually from an advertising agency, and then that holds merit. And something interesting that we see with billboards in Bend, at least, is that we don't have a lot of billboards, but the few that we do are primarily concentrated in the lower socioeconomic status areas of our community.
Thank you. That's really helpful.
All right, I'm going to move on to the second question now. You touched on this a little bit in your presentation, but I noticed in your data that youth in Oregon are seeing more online advertising than adults. So why do you think this is occurring, and are there specific challenges related to regulating online advertising?
Yeah, that's a good question. Yeah, so we did see that youth reported more exposure to advertising online than adults, like you said. I don't know, maybe that's because youth live online. I can't really speak to how to regulate online advertising. I'm not sure.
Are there any current
I know
regulations?
What's that? I'm sorry.
Are there any current regulations for online advertising for marijuana?
I don't think so. I think it would be maybe site specific. And Julia, would you mind? I don't know if you remember. Doesn't Facebook have a policy? I remember talking about that a long time ago.
Yeah, Facebook does have a policy. I don't know how. I think the enforcement of that relies on people flagging posts that they see that are advertisements. And I do know that in talking about this with Washington folks that, the monitoring and enforcing online advertising is just a really big, that would be a very challenging thing to do. So I think as Stephen is saying, it's kind of a gray area right now.
And if I may add with the online advertising, so Facebook and Instagram, if you have the word marijuana in it, it gets flagged for review. So I know those companies at least do some sort of enforcement, but there's other ways to get around it, obviously.
Mm-hmm. Great, thank you.
All right. Are there any other questions from anyone in the audience? I noticed some of you are unmuted, so you can just speak out if you like, or you can type it in the chat box on Skype. Well, since no one's saying anything, I also am kind of curious. I didn't write this down, but I'm curious about TV advertising as well. I think you said it's illegal at a federal level, but are there local TV channels that can have marijuana advertising in Oregon, or how does that work? Because you did mention that some adults were seeing TV advertising.
Yes, some did report that. I think because cannabis is still illegal at the federal level, I'm gonna need help with this one too. Sorry. I think it's more about like stations would be probably unlikely to air marijuana ads in fear of, say, like the FCC coming down on them. So again, kind of in fear of the federal regulatory bodies. So I don't necessarily know that there's a law saying that it can't be advertised on TV. I know it can't be advertised in a way that promotes consumption. There's something specifically about that. But in terms of just like advertising your store, I think that would be more just a station being afraid of a federal interference. Sorry, I didn't mean to interrupt whoever that was.
It's okay. I don't mean to interrupt either. When we did some systematic focus groups of young people, when we asked about TV, they basically said it was like TVs in various businesses that kind of have like the different slides essentially flipping through. So that's what they were saying when they said TV, at least in our community.
Okay, thank you.
That's very interesting. Thank you.
Yeah, it's so helpful that everyone has all of these great experiences.
All right. Does anyone else have any questions? All right. The last question here is, of course, where can viewers go to learn more about your research?
Yeah. Well, if you haven't looked at the AJPH article, check that out. There's also a condensed, slightly more fun version on Public Health Post, if you look that up. And then we also have kind of like everything you could ever want to know about marijuana surveillance in the Oregon Marijuana Report, but that's a little dense. And then, I don't know, I'll turn it over to Julia, who's kind of she is our leader on all things marijuana research. I don't know. Julia, do you have any other suggestions?
No, we have several publications that are in review now and plan to release, and we are presenting some of our findings at a conference that's coming up in Portland in May. So I don't know if we could share information about that conference if folks are interested.
Sure, and if you could also share, like, maybe send me an email with links, if you have them, for the Oregon Marijuana Report and the Public Health Post.
Yeah.
So people can read over those if they like. And then, do we have your permission to just share the PDF copy of your article that we have with Coalition?
Yeah, I think that's okay.
Okay, great.
Wonderful. Thanks so much.
The audience, and it seems like there weren't any. So thank you, Stephen, and thank you, Julia. This important research on marijuana advertising that jumped in with their fascinating information about TV advertising.
Thank you. Thanks for the opportunity. I'll send those links.